This morning, in honor of Black History Month, we are discussing disparities among communities of color in terms of women's health issues. Joining us this morning to explain all of the details is Miss Raven Burrell. She is a physician's assistant for an OBGYN clinic for Delta Health Center. Good morning to you.
Good morning.
Now, we have a lot to jump into, a lot of interesting numbers that we want to hear about, and also to hear about what you guys are doing at Delta Health Center to try to get some of those numbers down. But before we do, explain to us, to me, what is a physician's assistant? What exactly do you do?
So we work collaboratively with a physician, and we work in different specialties as myself in obstetrics and gynecology, from family medicine, from occupational therapy. So we see patients from beginning to end. We take histories on patients, we diagnose patients, we order labs, we order ultrasounds or x-rays or imaging that's necessary, provide treatments. We're able to prescribe as well.
Now, the disparities that I mentioned, what are some of those that you see?
Here in Mississippi in itself, maternal mortality has actually been increasing, and that means pregnant women are dying, and especially Black pregnant women are 4 times more likely to pass away from a pregnancy-related death, whether it be during pregnancy, during labor and delivery, or even 1 year after delivering. Black women are 4 times more likely than non-Hispanic white women to die from pregnancy.
And why is that?
Causes.
What are the reasons? Or do you guys know?
So in terms of like in Mississippi and the research that has been done, a lot of the reasons are preventable. So 8 out of 10 of these maternal mortalities are preventable, meaning one of the top causes is cardiovascular diseases. And so we do have to look at it comprehensively in terms of our health infrastructure here, in terms of access to care, in terms of expansion of Medicaid to include that postpartum period, which is a year after delivering.
And right now it's about a 3-month window of time that those women are allowed, correct?
Right, correct.
Right. One issue that you and I discussed earlier is that you see a common thing to where women, for a lot of reasons, are coming in for delayed care, expecting women coming in for delayed care. What for you would you say to those that maybe have put off care? What's the importance of coming in sooner? What do you tell these women?
That first trimester, which is the first 14 weeks of that pregnancy, is the most vital development of the organs, the heart, the limbs, and accessing care within this first trimester is most important to have an overall healthy pregnancy. So we talk about also considering the access to Medicaid and Medicare, where the most vulnerable populations who are of reproductive age here in Mississippi sometimes don't have insurance. So we're stressing not only entering in your first trimester, but there are resources that we have here at Delta Health Center, from our social worker to our psychologists, to just providing that network of care, of knowing that we have Medicaid opportunities that we can enroll our patients in, so then that they don't have to worry about that financial barrier that is to accessing care.
Right. In terms of post-birth, what are things that you see that you'd like to see change?
Post-birth is a year after delivering. The post-birth warning signs that can happen is from hemorrhage to having postpartum hypertension, and women at more at risk for chest pain or shortness of breath or temperature changes, or things that we call from hypertension and being preeclampsia that's related postpartum. So in terms of that, I would like to see expansion in Medicaid. I would like to see here at Delta Health Center, we're practicing to have our women coming in more frequently. We're seeing them 1 to 2 weeks after they deliver, and also following up with them every month, depending on what their health outcome is after pregnancy, and keeping that up until a year as much as we can do, as their insurance will cover.
Ms. Raven Burrell with Delta Health Center. She is a physician's assistant with an OBGYN clinic, again with Delta Health Center. Ms. Raven Burrell.
Thank you.